Most days when you step outside, the sun is shining, but sometimes that breath of fresh air that you're expecting is clouded by poor air quality.
The Environmental Protection Agency actually has some guidelines set up on air quality. They put certain levels there that are hopefully to help us decide whether it's a healthy environment to be in, and they can rate it as mild, moderate, or severe.
The Environmental Protection Agency has an air quality index that levels from 0 to 500. The higher that number is, the greater the level of air pollution.
Normally a level air quality index of less than 50 is what we would consider normal or healthy. Once you start getting up into that 100 point on the air quality measure, that's where people with lung disease or at-risk disease processes that it may affect their breathing will have troubles. And once you get into the 300 range is where we start seeing either patients without any lung disease having problems.
Recently, fires from Canada have been affecting the air quality in the eastern side of the United States. Meteorologists use different models to determine where smoke from those fires will travel and potentially affect the areas where you live.
We have computer models that guide us and show us where the smoke is now and where it might be over the next 24 to 48 hours. So we tend to look at those and able to let people know whether or not the smoke's going to be pretty thick or not.
The jet stream plays a role in that.
Let's say the fires are in Western Canada, and if the jet stream is coming in, going north through Western Canada, and then turning the corner and coming back down, straight down from the north like it has in the recent past, that will bring that smoke down, and it depends on how long that jet stream pattern will stay like that.
Dr. Herrick says how you will be affected when the air quality reaches certain levels all depends on your sensitivity.
It's just like allergens, that if you have allergies to cats and you walk into somebody's home that has one cat, you may have a severe allergic reaction, where if you don't have any allergies, you may never know that the cat was there. So it really depends on your sensitivity to whatever that particulate matter or whatever that problem in the air is. If you're an asthmatic, it may cause you to have more chest tightness, more shortness of breath, more wheezing, and those kind of things. And as a normal person per se without any lung problems, you might not have any symptom whatsoever at the lower levels.
And if you are at risk or just want to take extra precaution, there are some steps you can take.
Making sure your windows are closed and sealed, making sure you avoid extended periods of time outside, make sure you avoid excessive activities that would cause you to maybe breathe in deeper, heavier, or longer. If you have an air conditioner, make sure that it's working appropriately and that your filters in your furnace area are changed. To collect that debris are probably the most important things you can do to maintain an adequate air quality in your home while the air quality outside is poor.
Addressing air quality concerns so you can stay on top of your health.
Obviously, this is something that is concerning because of all the media that's going out, and that's why we're talking about it right now. And if you do have a lot of symptoms or a lot of concerns, then getting hold of your primary care provider and just making sure that you keep good lung health.